Courtney, tell me, why did you choose the ICU?
I chose the ICU because I like the acuity of the patients and having to learn all about every symptom and diagnosis that they have to problem solve and to treat them and give them quality care based upon a holistic view, not just one certain diagnosis that they've been given.
Okay, I like that answer. Can you explain to me a high-stress situation when you needed to keep a positive attitude, and were you able to?
I was started out in the ER one day, and I had a patient come in that they couldn't figure out what was wrong with her, and she was completely dehydrated. She started becoming delirious to the point where she couldn't speak, and they couldn't figure out what was wrong with her. So we took her to the cardiac ICU, where we discovered that she had a perforated esophagus. So during this time, her family was there and they were stressed out. So keeping a positive attitude about being able to figure out what was wrong with her and to help her get through the stressful time, because she was still awake and they vented her while she was still, they didn't sedate her. So keeping the positive attitude and not freaking out and having anxiety and letting the patient know that you're anxious about the situation helped her stay calm, as well as we had to find a way to communicate with her because we still couldn't figure out what was the whole picture yet when she first came in. So I started having her write down everything, and we communicated by pen and paper instead of talking. So positive attitude will help you find different ways to communicate and assess what's wrong with the patient when there's problems.
Okay, great. What about, can you tell me a little bit about your goals in terms of continuing your education?
I plan on continuing my education by going to CRNA school or becoming an ACNP. I want to be overall involved in patient care, either by helping them get through the surgical process or labor and delivery, by just knowing that they have people there for them who can help them through the pain, and who will be there to oversee their actual breathing and airway and everything, and they'll feel safe and comfortable with that. Or ACNP by treating a patient and having a personal relationship outside of the acute unit.
Okay, great. What do you think are the most challenging aspects of meeting your patients' needs?
I sometimes think that patients have a hard time expressing what they expect out of the care that they're getting from us. And so I feel like we provide them with the best care that we know how to, but it may not be meeting their psychological or social aspects, and it's hard to kind of feel like you're able to communicate with them on that level and seek out that type of information from them. And I feel like if, as a nurse, I knew what they were wanting to be done as far as what their level of expectations were as far as getting out of the hospital and how they would feel afterwards, and not being involved in their social realm, that we could help them better prepare for their dismissal from the hospital.
Okay.
No laughing in an interview.
Okay. So, how would you handle an order that you disagreed with?
If I disagreed with an order, I'd first read it a couple of times to make sure I was getting it right, and then I would use like the micromedics or the different aspects on the computer that would further allow me to explore the situation at hand to see if maybe I was thinking about it wrongly, or if the doctor who had ordered it may not have understood the whole process. And then I would refer to a nurse or a manager that I trusted and felt that could appropriately answer my questions. And if they felt that it was still not an acceptable order, they weren't comfortable with it either, I would then go to the doctor and see if we could change it and maybe bring it to their attention that there may be a better possibility to treat the patient.
Okay, great. Well, you're hired, so
Great.
you got the job.
Woot.
And thank you so much.
Yay.